Every diagnosis carries a story, and every treatment carries hope. Welcome to Doctors on Air, where science is guided by empathy and every conversation puts people first. With me in the studio, I have Dr. Ayel, a fertility specialist at the Bridge Clinic, and Mrs. Aban, a fertility counselor and emotional manager at the Bridge Clinic. It's a pleasure to have both of you here with me.
Thank you for inviting us.
Maybe I should kick off with talking about the issue. Why is it that in our culture, and when I say our culture in Nigeria, I mean across all cultures in Nigeria, when we think infertility, we call it a woman's problem?
That's an interesting one. But I think all of this stems from a lot of cultural mindsets that people have had over the years, and the perceived role of the man in the communities from which we all grow from, where they see men as maybe demigods in some settings that shouldn't be questioned. And you find out that whenever the women are unable to conceive, generally it's believed that the women are the problem. And of course, I'm sure you're going to touch on this later, on why it is that men do not present early at the hospital, because they believe the women should go sort themselves out, and it's after running from pillar to post before some of them reluctantly come in. That's if they ever come in at all.
And what are your thoughts on this subject?
Yes, culture has a very, very significant role in this matter because, as we know, even at weddings, they announce in 9 months' time, we'll see you. And that 9 months' time is not projected at the man, it's projected at the woman. We need to see evidence that you are pregnant. And once she's not pregnant, the society will put that burden on the woman to go and sort herself out. So it takes a while for the man to think, maybe I should check myself. You know, everybody's looking onto the woman to go and check herself out. I think culture has a significant role to
The
play.
interesting thing for us is that we are a mixture of several tribes. We're a mixture of so many different peoples, Christian, Muslim, in between. And yet everybody has that expectation. Is it an African expectation? Or is it, why is it that the woman must carry that load?
I think, like Sabang mentioned, the society hasn't helped. There is that mindset that it's the woman's problem. That is one. And then if you look at the fact that we know that no matter how fertile a woman is, the reality is that there's something called menopause. And men in their seventh, eighth decade have been known to still, conceive with women. So that gives this false sense of security that men are not affected by decline in fertility.
Well, that's a very good one. And I think that actually helps a lot in the thinking. So how common really is male factor infertility in our country? Or in the world, shall I say?
Interestingly, it's actually very common. And it might surprise you to know that men actually contribute as much as women to the burden of infertility. The numbers of infertility, and I think prevalence is somewhere between 15 to 17%. And the men contribute about half of that number. Staggering. But if you look at the willingness to come into the hospital, to come into the clinic, to be examined, for every 10 women that come in, you probably see one man walking to check himself. So there's that disconnect between the reality and what people think should be the case.
It's actually very interesting because recently I was told that at the Bridge Clinic, they have had a session called a Season of Clarity, and a number of men have actually been coming forward.
Oh, absolutely. And I think the good thing now is that there's a gradual shift in the awareness, in the narrative. A lot more people are exposed. And of course, this is one of the benefits of the social media. There's a lot of information out there at people's fingertips. They can readily access this information. So unlike maybe some 5, 6, 7 years ago, or even a decade back, you see more men coming unaccompanied, alone, just wanting to have their semen checked, wanting to have their fertility assessed. this was not a very common scenario.
Unheard of before.
Absolutely.
Unless they've been having problems getting women pregnant, of course.
You ask them, I mean, why did you come for testing? I just want to check. I mean, that's a very pleasant experience, or that's what we see now.
I may come in here because when you look at the population of our age in those days, the focus is on the women. The age now is that we do it together. So the man does not have to, the lady just has to turn around and say, oh boy, I think we have to go for a checkup. And he will move, because that's the orientation of the people of this age. You know, with social media, you have not shown evidence that you have delivered. So, so the woman does not even need to push. She doesn't need to talk. I'm checking myself. Oh boy, are you checking yourself? So I think it's working out. The onus is for us in the fertility services, you know, to project a lot of information out there that we are ready to welcome them together, and we don't treat you individually, we treat you as partners, as couples.
I think this is so important. So we're looking at an older generation, which actually still have problems or fertility problems that they don't want to address. They're doing what I call the ostrich behavior. The man putting his head in the sand and saying, no, it's got nothing to do with me. But the reality is it does. And I think, you know, some of this behavior actually causes more problems for the man than he knows. Because instead of sticking with perhaps his wife, who is honest with him, he then starts running around and some woman says, well, I'm pregnant for you. And at the end of the day, what do you find out? These are some of the cases that you find of paternity test that is negative. And he had somebody who was true to him and he should have stayed with her. So let's talk about the causes of male factor infertility. Can you tell us a bit about why is there male factor infertility?
Male factor infertility, the causes, you know, they are multifactorial. And we have a lot of these causes that are reversible, you can modify, and then you have those that you can do absolutely nothing about. And in this environment, a lot of the ones you can modify actually exist, you know, and this can be traced to
Can you share some of them with us?
Sexual behavior, you know, poorly treated sexually transmitted infections, either not identifying them, or when you identify, you do not treat properly, you do not complete antibiotics. And of course, there are those things that just develop through no fault of yours, but at least you can do things about, you know, things like varicocele, right? These are abnormal veins around the testis. The way the testis has been designed by God is supposed to thrive at a very lower temperature. That's why it descends in the scrotum away from the core temperature of the body. When you have people that have these abnormal veins that encase it and increase the temperature, of course, the urologist can help manage these conditions to improve it, right? Then if you also look at social factors, you know, smoking, nicotine, substance abuse, all of these things impact negatively on the sperm quality, and of course, all of this promote male factor infertility.
Well, the good thing to know is that they are preventable, and we'll talk about that now. So, how have social and lifestyle changes affected or increased male infertility in recent years? Some people say that, you know, factors like pollution, because they've cited the fact that there's been a decline in sperm count. Can you tell us about this?
Absolutely. And I think it will be difficult to discuss this without touching on a very prominent review that was released a few years back that looked at the pattern of male fertility from the early 70s up until present. And it found as much as a 50% decline in the quality of the male sperm. Very staggering.
That's very staggering. That is shocking.
Absolutely.
50% decrease in the quality of sperm.
Absolutely. And in fact, more shocking is the fact that there appears to have been an acceleration from the early 2000s till date. So what has changed? Industrialization, more industries, well, more exposure to gadgets, technology, even things as basic as our devices, iPads with electromagnetic waves have been linked to some affectation of the male fertility, particularly for men that place laptops on their thighs while walking, which is something we increasingly see in this environment.
There's a message there, so the young men should really take note of this.
Yeah, absolutely. So some of these seemingly innocuous activities could have potentially very disturbing consequences.
And if I may come in, Dr. Ayo, the cooking methods have changed. There are so many chemicals that have been introduced into the foods that we are eating now. GMOs, so many of them. And the impact of targets at workplace, putting the men under undue stress. And in order to abet those stress, it's affecting their lifestyle, taking a lot of alcohol, smoking, people that would normally not do that. They are, using that to abate all the situations that, they are being exposed to, the tension out there.
I mean, I couldn't agree more with you. If you look at it now, if you look at sportsmen now, back then, maybe some 2-3 decades ago, the average lifespan in terms of sports of many athletes is maybe by their late 20s they are done. But you see a lot more athletes, performing well into their 30s and even 40. What has changed? A lot more medications, a lot more substances that we think is not harmful now, but may potentially affect a lot of these things that we're seeing now. And things like steroids, which we of course know has a direct impact on male fertility.
Well, I think this is important. I mean, to understand the kind of genesis, the causes around it. I know our listeners have certainly found out. But I think what we look forward to is perhaps understanding tests and understanding what treatments are available. And we'll take this after the break. Thank you for being with us, Mrs. Abang and Dr. Aya. It's a pleasure to have both of you here with us and talking about this very important topic. So we were talking before the break about, causes of male factor infertility and how, unfortunately, male factor infertility is very common. So can you tell us what kind of tests are available, particularly at the Bridge Clinic where you work, for men seeking exceptionally to know their status?
So we have a couple of unique brands, unique offerings that address this particular one. But the most practical one will be the Fertility for men. So men can actually come in and do. So the beautiful thing about assessing male fertility is a simple semen production can answer 80 to 90% of the questions as far as the male fertility is concerned. The semen test will tell you about the concentration of the sperm, which is directly linked to the quality of the sperm. Of course, the movement of the sperm, right? We have parameters, we have benchmarks that need to be attained for us to say that the sperm is of great quality. Then, of course, the appearance of the sperm. So typically, men will produce millions of sperm cells, but just a small proportion of these is actually able to do the job. And that takes us to the appearance of the sperm because a lot of them will be abnormal. So this test is able to help us, address this and evaluate them properly. Then, of course, if we have issues with the semen parameters, the additional testing that can be done, like scrotal scans to look at the testes to see if there are abnormal veins around it. Is it of the normal size? Is it shrunken? This kind of information. Then, of course, there are also hormone tests that can be done. Your testosterone level, your FSH, your follicle stimulating hormone levels. All of these are ways of assessing male fertility, which can be done at the Bridge Clinic.
Fantastic. And so, Mrs. A, if we can talk about now the importance of having that fertility, because nowadays everybody is happy to go and do their testing for ASSS, know their genotype, because they know the importance of having
their genotype.
Knowing their genotype and not having a child with sickle cell disease. But, do they know the importance of fertility testing? Back in the day, some mothers used to say, we will not marry a woman unless she's pregnant. I'm sure you've heard this before.
It's still going on.
It's still going, see?
Still goes on in some settings, absolutely.
Yeah.
Shockingly.
It's shocking because you can imagine the kind of pressure that it puts again number one on the woman, and it's not actually compatible with a lot of ethical thinking, and particularly religious ones. So this is an opportunity for people to know their state and also to manage their state. What do you think about this, Mrs. A?
I think it's a very, very important thought process to go through because it takes away the anxiety that has to when there is delay in having pregnancy occurring. So this opportunity is creating awareness for them to say, come in and have, even if you are not ready, have some information. What do I do? The churches in those days, they promoted sickle cell testing, and to exclude all that, some churches will say, go and do your FET sure, like Dr. Ayo said. But the most important thing is, with Bridge Clinic, you have a free consultation with a counselor. Why don't you come in? Oh, I'm not ready. This is what I am going through. Some people, women, once they start their period, they start experiencing some things. The men also, once they start breaking their voices, they begin to wonder, what am I supposed to know? Education is power. It doesn't make you any vulnerable, not to seek information. That information can take you to good dieting, can take you to good lifestyle to prepare for the future. Come in. We do have platforms whereby you can come in for free consultation. Oh, I need to see the counselor. We provide that soft landing for you to come, sit down in a very congenial space and speak up with all confidentiality without any fear of bias. And that information helps you to prepare to have information. Oh, this is what I should do at so and so and so age. You don't wait until a woman is 35 and she now walks in and says, oh, I need to cryopreserve my eggs. Before then, where were you? You could have had that information given to you. So it's very important that we are creating this awareness on this platform.
So at what age are you telling people that they need to have this information? From what age should they be thinking about it?
I mean, as soon as you think you are ready to begin to start a family, right?
So we're saying in their 20s.
Yeah, I mean, 20s, early 20s, very critical because if you look at it, I have had female patients that have gone into premature menopause as early as 21, 22.
Wow.
Yeah. So, I mean, this is one end of the spectrum, but it's very possible. So for the women, I would say, for both actually, I would say your early 20s would be a good idea because we start talking to children about genotype, knowing your status and all of that early on. It's also not out of place to begin to have this information. And if you have any concerns, even sex-related education now is being discussed in schools at a younger age. Right.
But thank you. I think it's important. So for both sexes, we're saying that it's possible for them to know, and for men, it's even easier with the sperm analysis. So if I can talk to you as a counselor, how does male infertility affect men's self-esteem?
Oh, a lot. A lot. And I want to come in here. Religion and culture does not help the men. They feel when they express the vulnerability that, oh, I'm being affected by not being able to impregnate my wife or my partner. It's like as if they've lost their cap. Yeah. But they are anxious, very anxious and very worried. And in that anxiety and worriness, they seem to isolate from their partner or their wives. And that affects the bridge of communication. And it heightens the infertility also. If Dr. Ayo were to take their samples to say, let me find out, you'll find out a lot of disparity. So they have this emotional experience through shock, anxiety, stress, guilt, shame, Some even go into depression by that isolation. So those are the trends that they experience. But what we are providing for them, creating awareness, is a normal trajectory of somebody who has found themselves in a place they did not prepare for. Why don't you seek help? Thank God for Bridge Clinic. At your first instance, you can come in and speak to the counselor in a safe, comfortable place. Speak. We don't offer you treatment immediately. You need to speak out so that you are healthy. You need to speak out so that you find yourself living with a clearer thought of what you're experiencing. It does affect them.
It does. In fact, it's very interesting because initially I was actually, when we spoke just before the program, I was accusing Dr. Ayo. I said, Dr. Ayo, why don't men come out? For example, for this program, we've had a lot of men treated at the Bridge Clinic with infertility, even with azoospermia and so on. That's what he was saying. I said, why aren't they here on the program talking? If I wanted to talk about female infertility, we would always have a patient ready and willing to talk about it, but men don't talk about it. Dr. Ayo, what are your thoughts? Why are they not talking about it? And Mrs. Abang, how can we get men to start talking?
It's not something that would be solved overnight, right? It's deeply entrenched in the cultural stereotypes. The women are perceived, men are perceived as head of the family, the carers, and then back then when the polygamous setting was very popular, it was a case of, okay, if this woman is not bearing children, I get another one, you replace it. But all that has changed. Most people now are more comfortable just with one man, one wife. Of course, the reality of today's life, promotes the single partner kind of arrangement. So for men too, they want to get it right. But for us to change that stereotype, that thinking, is going to take a lot of advocacy, awareness, and trying to get men to understand that you speaking out does not mean that you're weak. Because this alpha male mentality is something that a lot of men work with. And, anecdotally, you hear people talk about, okay, even backed by data, that the female partners tend to, maybe in terms of lifespan, longevity is more wide. Men tend to bottle a lot of these things. And let's not forget the fact that they are also more likely to engage in some of these substances and these lifestyle choices that are inimical to fertility. So yes, I agree with you. Men do not come out as readily and as easily as women, and I think that has to gradually change. But it's not going to happen overnight. This is something that has taken decades, maybe millennia, to entrench.
I think I have to come in here, engaging the men. We have to take the services to where the men gather in the pub. We have to be there so that they all see that, oh, some of them think they don't have problem. Men don't speak like women, sharing their inner thoughts and their issues. But when they are all gathered together, they can talk. So maybe we need to penetrate where the men are having their relaxing moments, create awareness there. I think that's one area. Two, when women come in, most times we engage them without even insisting that, where is your husband? Where is your partner? At a certain point in treatment, when they come before me, I said, well, Bridge Clinic does not want to give an away father a child. We want to see the father. So if all of us are embracing, starting from little concepts like that, making sure that when you come in as a woman to make the inquiry, we insist that in proper management, let the husband or partner be there and follow through with the treatment. The partners that work together, they succeed faster. They cooperate with one another. Relationship is being sustained, and it's a happy family in the long run. So it's how we inculcate them into the management.
Unfortunately, time is actually already gone. But I'd like you just to give your last words. Also, just mentioning the treatment options that are available at the Bridge Clinic for men.
We have quite a number of treatment options, and a lot of this treatment is tailored to your particular issues. And of course, this after doing an evaluation, we're able to direct treatment appropriately. It could be something that just requires some medications, supplements, antioxidants to help. And of course, for those with the more severe cases, we have our advanced fertility solutions, IVF, ICSI, direct sperm injection to help this kind of couple to achieve conception. And I know we're out of time, but just as a final word, I would just like to say that when I see men with almost impossible cases able to have successful pregnancies, this further strengthens my resolve that nothing is impossible, and all you need to do is to try. You might just be able to make it work for you.
Thank you. This program has been very enlightening, showing how infertility is not just a woman's problem, but from our medical experts at the British Clinic, it's clear that there are steps every man should take to take care of his fertility, because in our society, having children is very, very important. And there are things that can be done for you to diagnose if you have a problem or if you don't have a problem, so you can take steps to preserve your fertility even from when you are young. And if you do find out there is a very big problem and you're having difficulty having children, don't give up hope. There are treatment options, and at the Bridge Clinic, your problems can be solved. So I'd like to say thank you to our medical experts for coming on the program and for giving us on Doctors on Air trusted and helpful information, things that everyone should know. Thank you very much.